Play is the most important thing for a child. It is the language in which children communicate and probably the most effective way they can get their needs met from their caregiver. Very often, caregivers will engage in play with their child and inadvertently engage in behaviors that are triggering behaviors, such as asking too many questions, giving indirect or direct commands, things such as, "You're coloring that purple," when really it's suggesting judgment, even though they may not intentionally mean judgment by it. But for a child who may have some dysregulation or challenging behavior, they may display a behavior as a result of that question, although the caregiver meant nothing by it. PCIT stands for Parent-Child Interaction Therapy. There are 2 phases in treatment. Phase 1 is child-directed interaction, and phase 2 is parent-directed interaction. Most caregivers enter treatment, and their biggest concerns are defiance, emotional dysregulation, not complying with bedtime, chores, routine structure. There might be misbehavior in the classroom. Very often there's significant concerns with public behavior and managing the child in the grocery store, things of that nature. PCIT improves parent-child relationships and interactions and ultimately works to increase compliance and decreases overall child challenging behaviors. PCIT is meant for children who are ages 2.5 to about 6 years and 11 months, chronologically and developmentally. So we want to make sure that they have the ability to understand basic concepts, so at least 2.5, again, developmentally and chronologically. When we start parent-child interaction therapy, the first session is an observation session where we have several different scenarios to see how the child responds in play. And then after that observation session, we process how that went, whether it was typical or atypical. And then after that session, we have a parent or caregiver session only where we talk about the skills. That will be the child-directed interaction skills. And then from there, there's live coaching sessions that happen weekly, and there's homework that the caregiver is responsible for. It's only 5 minutes of play, which really doesn't sound like a lot, but it truly has made a difference. And the research says that 5 minutes of play per day with one caregiver can absolutely result in significant change. PCIT has been probably the most effective treatment I have seen over my career, and it has been truly amazing to watch the progress that has occurred in treatment. I've seen children start in treatment with some very challenging behaviors, significant emotional dysregulation, and then blossom into children who are able to function in a classroom environment, able to allow me to have a conversation with their caregiver and play and self-regulate without having to even interrupt. Very significant gains in treatment. So initially, it's very overwhelming for the caregiver to have so much feedback. I will describe the coaching as intense, but caregivers have often given feedback that it's been so very helpful, and even at graduation have said things such as how appreciative they are and that they hear the coaching in the moment when they're becoming dysregulated themselves, that they can hear me saying, "Take a deep breath, you've got this, you can do it," and that it's been very helpful in their transformation with their parenting skills. I feel so proud when I see caregivers come in who already have some skills and we're just adding additional skills in their toolbox. And then when you see the child begin to praise their caregiver or use skills that they've learned in treatment with their caregiver, such as, "Mom, you did a great job using your manners," or "Dad, I really like that you shared your toys with me." Those moments make everybody's heart smile. So a caregiver or a parent who would be interested in PCIT would need to be highly motivated, attend weekly appointments, and be willing to complete daily homework with their child. The sessions are about an hour in treatment. And then after that, we're looking at anywhere between 18 and 22 sessions, depending on the caregiver commitment and also their progression of their skills, as well as the child's behavior and their response to treatment, which we continue to assess throughout the treatment process. So if they were interested in parent-child interaction therapy, they would call our office and ask for an intake appointment, and from there they would be assessed and determine if PCIT would be appropriate for them.